I come from the College of Medicine, Nursing and Health Sciences in NUI Galway, which has in its strategic plan that there is part of its internationalisation agenda is capacity building in education, research and scholarship in the developing world is the language that was used. And that we'll work with the Saolta University Hospital Group to develop a programme of links. So for those who don't know, but the health service in Ireland, hospitals have been grouped into 8 groups of hospitals. So the hospitals for the west of Ireland there's 6 hospitals in it, from Letterkenny in the northwest down to Galway. And there's a recognition across the hospital group that multiple links, and we'll hear about Maeve's one later, there's links between hospitals in multiple parts of the world. There are people working in nephrology, there are people working in obstetrics, there are people working in various aspects of healthcare. There's links in Sligo, in Letterkenny, in Mayo, in Roscommon, and in the Galway hospitals, doing all sorts of different things across some of these. Some people are linked into COSEXA and into other projects already. So the hospital and the university together want to do something more coordinated around this. The hospital groups in Ireland also have buddies. They have partners, mostly in the UK and in the US. And Saolta's partner is Northumbria NHS, Northumbria Healthcare Trust. And this is the hospitals in the Northumbria region in England. And they have an international health links network. And they enable staff, and some of these are linked through THET, they enable staff to engage in projects with their partner institutions. And they've got HR methods so that people can take leave and all sorts of other things, so that it's part of work as opposed to something outside of work. So we started looking at how we might work between NUIG, Saolta and the Copperbelt University and others in Zambia. So we got an ESTHER startup grant looking at the links between the two of us. I worked in Zambia a long time ago, and a colleague of mine, Victor Mukonka in Zambia, is now working in public health in the Copperbelt University. So we put this in to see how we go. We reckon that there are shared values and interests. All medical schools, nursing schools, hospitals have all sorts of strategic objectives about partnership, about improving healthcare services, learning and teaching. And we can see that there's the potential for mutual learning and co-development through all this sort of thing. So for those of you who don't know where Zambia is, Zambia in 1964 at independence had 3 million people with 100 graduates in the country with 2 indigenous doctors. The University of Zambia was established in 1966. The medical school was established in 1968, and there have been 1,800 graduates to date. This is in a country of 14 million people. So we talked about looking at how we might link Ndola and Galway in the west of Ireland and the Ndola region. Just some background on the populations of the two countries and sorts of issues that we have. The population pyramid on the left is the Zambian population pyramid. You can see it's a predominantly young population, and there you've got the Irish population pyramid. And some of the key indicators, like our life expectancy is over 80. In Zambia, it's 50, and that's an improvement. It had declined further with the impact of HIV. Our maternal mortality rate is 8, but it's 220. Not the worst in the world, but that's grim. Our infant mortality rate is only 3. Our health expenditure as a percentage of GDP is nearly 8%. It's coming back up. We have 2.7 doctors per 1,000 people. Zambia has 1.7 doctors per 10,000 people. We have 12 nurses per 1,000 people. Zambia has 7 per 10,000. Thank you. So just as an indication. Oh, it's blocked. Is this stuck? Oh, there we go. So, and when you look at the distribution of doctors in Zambia, I can't see. I have to figure it. The red button. Okay. These are the urban areas where most of the doctors are concentrated. You've got huge tracts of land where there's 1 doctor per 18,000 or 20,000 people. So are doctors the answer? Not necessarily. We'll talk about that in a minute. So we talked about linking our universities. The Copperbelt University is a relatively new university. It's the second university in Zambia, the second public university. And we talked about looking at our schools of medicine and nursing and health sciences. So they have a new school of medicine that the first graduating class graduated this year with 41 students. There are 132 in the first year that just started, and the plan is to go to 200 per year as part of the move to increase the number of doctors in the country. The School of Nursing has 350 students. They currently offer a diploma in registered nursing, in midwifery and in operating theatre nursing. And they're planning to move to a degree programme, which has happened here in the last 10 or 15 years. And then the hospitals, the Ndola Teaching Hospital has just numbers there, but it's a busier hospital than ours. It has, compared to, this is the number of attendances. These are, for Ireland, we can say they're the emergency department attendances, and they're the people who are admitted. So I've got the numbers for the Galway University Hospital and then for the whole Saolta group for the 6 hospitals. So the one hospital in Ndola has more than double the number of deliveries that we have in our hospital. And it's an 800-bed hospital compared to, we've doubled the number of beds across the whole of the west of Ireland. Multiples in terms of numbers of staff, nurses, but particularly looking at doctors. And I'll come back and tell you more about that in a minute. And nurses, the numbers are, there's huge differences. And then all the services that are delivered with that. So our grant was for an exchange visit to see how we might go. So that the dean of the medical school, the principal of the nursing school, and the head of the hospital came to Ireland in March. All men. But we'll come and talk about that as well. At the meeting, the first morning when they sat down with the hospital management in Galway and the medical school and the nursing school staff, the head of the hospital was describing briefly, the numbers of beds they have, the number of patients, and he said, and we have 17 consultants. And the manager of the hospital in Galway said, 17? 70? No, 17. 17. 800 beds, 17. The conversation just took off. The planned discussion and the presentations all changed from that point, just in terms of trying to make sense of how different the ways of working were. So we had an exchange visit back to Ndola in August with a visit to Lusaka as well. And now we have to come up with a plan and do something based on that grant. So we have an MOU under development. We're going to focus on the agreed needs for us both and the learning both ways are in education and training, aspects of education and equipment, research and service and practice. So there are big issues for curriculum developments. We had an email on Friday about the move to a nursing degree for and developing the curriculum for that. So we're going to see how we can link. There are all sorts of things we've got multiple online courses both in Galway and in other places that can link in terms of skills. There's certificates, diplomas and masters in teaching, in medical teaching. We have a Centre for Excellence Learning and Teaching that runs a whole range of different things. We've linked the libraries together. We've linked the learning people. They have an anatomy lab where the bodies are basically collected from the police. There's one technician runs it, and there's no trained anatomist. There's a surgeon. So, simple thing about developing. It sounds simple, but I mean, there's opportunities to do things straight off. The physiology is run by a vet who has done some human physiology, but there's nobody with a PhD in either of those basic sciences. And there's a huge issue about the nursing curriculum and the move to a degree. We're looking at student and staff exchanges that will be reciprocal, and a clinical staff development linking in with some of the programs that Frank mentioned earlier in terms of what the College of Physicians does about postgrad training. But the argument is then, is it consultant endocrinologists and consultant cardiologists that are needed in Zambia? Well, you can argue yes, but it's lots of other cadres of staff as well. And that gets us into that question of task shifting and task sharing. There's multiple opportunities for training of trainers in both directions. And the big need that's being talked about through both the Equals Initiative and the visits we've had is the development of some kind of specialty for family medicine or general practice or some medical primary care that would link with clinical officer training as well. There's multiple opportunities in terms of links on equipment, linking with the Equals Initiative, which it's already collecting information or collecting equipment from hospitals all over Ireland for storage in a container or in a warehouse in Shannon, as David mentioned earlier. Those are endoscopes that Frank and David were looking at in the container that left Dublin, and we were able to deliver these to UTH. So there's multiple other links in terms of equipment, simulation equipment for teaching, IT equipment, and multiple others that we need to work more on. We can see multiple research possibilities that might end up contributing to the 1090 gap, and we'll try to look at and adhere to the best quality principles of partnership from ESTHER and ESTHER, and looking at some of the specifics of what's been developed through the All-Party Parliamentary Group in the UK in terms of the impact of these sorts of partnerships on health here. We need to get this message through to the system here as well, that this is about, we're beyond aid, we're not talking about charity, we're talking about, one of the arguments at the TET meeting is we're talking about exporting health expertise. It's trade. Now, I'm not comfortable with some of this language, but I see that you have to respond and frame things to how people want to see things framed as well. And ultimately, the impacts are in terms of better health and stronger economies, and that a lot of these opportunities create jobs for women, and it enables gender equality as well. And feeds into multiple sustainable development goals. And we're now at this stage of developing a more clear strategy and figuring, like everybody else in the room, what are we going to do about funding and administration and governance systems, and looking at our options in that sort of a way.